Do you ever wonder what the Florida Psychological Association, the FPA, and the Psychologists of Florida Political Action Committee, the PAC, do for you as a Florida licensed psychologist? I'm Dr. Justin Dorenzo and a member of FPA and the incoming chair of the PAC. And I'm going to tell you, well, we make things happen like getting PsyPACT passed in Florida, allowing you with proper credentialing to have reciprocity in 40 states. You can serve more people, continue to serve your existing clients and patients who leave Florida for another PsyPACT state, and you can make more money doing so. 2023 is another busy year for us, and we're working hard to pass 3 more important legislative changes for psychologists to ensure that we can do what we do best, and for those who wish to expand their scope of practice. FPA wants all Floridians to have access to the best psychological care. So the first thing, we are working to modify the current Baker Act law to remove the 3-year post-licensure experience requirement for psychologists before they can Baker Act someone. You guys, in 2016, social workers and mental health counselors who have 4 years of graduate and formal training had legislation passed to allow them to Baker Act a patient immediately upon licensure. When again for us, it's 3 years post-licensure, even though our formal and graduate training is 7 years in comparison to their 4. We are trying to get this fixed. Number 2, TRICARE took back $30,000 from my psychology group, saying they had overpaid us for the previous 3 years. Now, currently, Florida health insurance companies can make claims for overpayment to a participating psychologist for up to 30 months after the payment of a claim. This was standard practice until it changed in 2008 for other doctors, but not psychologists, from 30 months to 12 months. We are working to get legislation passed to shorten the look back to 12 months, so it's equitable to physicians and dentists. Hopefully this will increase our willingness to participate in private health insurance. I know you guys also have your stories about dealing with insurance companies. And the third thing that we're going to do, so the military, the Indian Health Service, and the states of New Mexico, Louisiana, Illinois, Iowa, Idaho, and Colorado have granted properly trained psychologists the authority to prescribe psychotropic medications. Psychologists trained to prescribe would also be able to unprescribe, ensuring that all patients receive the proper combination of therapy and medication. Other states' experience show that approximately 10% of psychologists will elect to pursue prescription privileges. So that is a lot of us. Now, we are again pursuing legislation to make this happen in Florida for psychologists too. So you guys, please share our legislative priorities with other Florida psychologists. Consider joining FPA and working with other like-minded psychologists. Donate to the PAC. It's vital to our profession. With your involvement and support, we can better encourage our legislators to improve the laws in Florida, ensuring that we meet the mental health needs of all Floridians and our profession is protected, evolves, and is something that we are proud of.